You have often seen and heard me talking about sexual and reproductive health. Today, the topic we are going to discuss is specifically about those basic hormones that are responsible for our sexual behavior. That is, which chemicals or hormones in our body are responsible for our sexual performance. I will talk about just one of them, and that is the main chemical, the main hormone in our body, which is responsible for sexual behavior. Along with being present in us, it also plays a role in sexual capability. Today, we are going to talk about which chemicals in the body are responsible for our sexual behavior, what happens when there is a deficiency of these chemicals, how we can boost or increase them naturally, and when we need to see a doctor so that we can resolve our problems through consultation. Just like our body has many different chemicals working within it which affect our behavior, our mood is affected, our energy is affected, whether we are happy, sad, or stressed. A lot of chemicals in our body are at play as a result. A deficiency or excess of some chemicals can make our mood pleasant, a lack of some can make us feel sad, and an excess of others can greatly increase our stress levels. Similarly, there are some chemicals and hormones in our body that either enhance our sexual behavior or reduce it, and when they decrease, of course, people have to face many problems as a result. We will talk about testosterone levels, which is the most important chemical for sexual behavior and sexual activity, and it is especially significant. Its importance is very high medically because testosterone is a hormone and chemical found in both women and men, but in a specific amount, and the quantity that is necessary in men is very important. This is because men's sexual behavior is particularly determined by having a certain level of testosterone, or they can perform better because of it. As I mentioned, it is found in both women and men, and the amount that is necessary for a woman's body should be present so that she can perform sexually, and the amount that is necessary for a man's body should also be present so that he can perform better. You must have often seen that many people actually contact me at the clinic for this reason, have issues with hypersexuality, and then there are some people who complain that they have low sexuality, meaning they experience hyposexuality, that is, they rarely feel the desire to be intimate with their partner. On the other hand, there are people who say that they constantly have sexual thoughts running through their minds and are very active in this area as well. As you've often seen me say, I usually mention that basically, of course, if there is a chemical imbalance in our body, then many aspects of our sexual behavior and our emotional responses change. And in this, our thoughts and our stress also play a very significant role. For example, if your stress level is very high, your testosterone level automatically drops, and this effect starts to show. Testosterone is naturally present in the body of every man and woman according to their needs, and having a certain amount of it is very important so that normal sexual activity can be maintained and you can perform it properly. People whose bodies have testosterone levels in just the right amount as required, we can see that their mood is very good. The hair on their body, like facial hair, beard, scalp hair, and body hair, all remain in a balanced amount and are healthy. Similarly, their stamina is greatly boosted, their mood is very positive, and we can observe high energy in them, those who have an adequate level of testosterone. Likewise, their sexual activity is also perfectly balanced, not too much, not too little, and they enjoy their sexual life with their partner accordingly. On the other hand, people whose bodies have an excessively high level of testosterone also face many problems. For example, firstly, they may experience hypersexuality. It's not 100% certain, but it's possible that their hypersexuality is due to the higher testosterone levels in their bodies. Then again, it can also happen that people with higher testosterone levels tend to get angry more easily. Their anger is much more intense. Because, as I mentioned, testosterone levels are very closely associated with your energy. So, people who get angry very easily might also have higher testosterone levels. Sleep problems are also common. Those with higher testosterone levels can experience significant sleep issues. They may get very little sleep, their sleep is often disturbed, and their sleep duration becomes shorter. They tend to wake up repeatedly during the night. Similarly, their energy levels also appear to be very high. People who have higher testosterone levels in their bodies are often seen leaning towards hypersexuality. Most of the time, their behavior is more inclined towards sex. On the other hand, those with lower testosterone levels, they are actually the ones who tend to have more problems, those with higher levels in their bodies. However, in our society and among the people around us, we mostly see those whose bodies may have lower testosterone levels. As a result, their sexual desire, sexual drive, that is the wish to be intimate, has decreased, and they do not feel as much physical strength as before. For example, you may have heard people say that they feel very weak. In such cases, their testosterone levels might have dropped, and as a result, their body energy may have decreased. Their stamina also tends to go down. The hair on their body, especially those that are associated with masculinity, may start to fall out. A distinct way the belly protrudes, specifically in people whose testosterone levels are low, we very commonly see obesity in them. Weight gain and a bulging belly are noticeable, as is hair loss. Similarly, we often see these people tending towards depression. They frequently display a low mood. We notice a lot of disappointment in them, and happiness seems to have disappeared from their lives. They don't feel like doing anything. Their energy becomes so low that they don't want to do anything at all. And when depression starts to set in, life doesn't seem pleasant to them anymore, and their desire to live also appears to diminish. It has been observed that people with low testosterone levels can experience erectile dysfunction. That is, the firmness, arousal, and tension required for sexual activity may be lacking. In other words, their sexual health is affected. As I mentioned earlier, their heart is already less active, and then their body also starts to get affected because of this. It is possible that they begin to sleep more because their body starts to feel very lethargic, and then it seems like they are sleeping excessively. Often people whose testosterone levels are a bit higher than normal, that is, higher than the required amount, or those people who need to increase their testosterone levels but already have higher levels in their body, we often see heart problems in them as well. That means their risk of heart attack also becomes a bit higher, especially for those people whose bodies already have high testosterone levels, or those who are taking medicines, injections, or these shots to increase their testosterone levels. Their chances of heart disease become higher. But at the same time, those people whose bodies have low testosterone levels, if they take treatment or medicine to increase their testosterone, then when their testosterone level gets boosted along with many positive effects, their heart also starts functioning better than before because blood flow starts to improve a bit. So these are some of the changes that happen inside your body due to having either low or high testosterone levels.